Dr. Alex Nguyen. Nguyen.
Nguyen, Nguyen, I've had it all, man.
Okay, I've been calling you Alex Nguyen forever because I had a girlfriend when I was like 20 years old in the Marine Corps, and she was a Nguyen, spelled the same way. Are you a Nguyen?
Sorry to hear that. Vietnamese
Wait,
women
and
are
were you possibly
tough.
related to her?
I was not related to your ex-girlfriend. Odds are, I think there's like 40% of us are wins for Vietnamese people, but no, wins fine. I tell people win. It's easy. It's fine. You have to just explain why, but it's fine.
How do you
Win's
say
good.
it?
Oh, dude. Yeah.
Welcome back to the All In, All On X podcast, where we take you behind the scenes of full arch dentistry, innovation, and the people who are redefining what's possible. Here we go beyond the procedures and into the lives of people shaping full arch dentistry. This isn't just about implants or workflows. It's about the lives we build, the decisions we make under pressure, and the leaders who push this profession forward when no one's watching. Get your head straight, because we're about to go all in. The All In, All NX pod is brought to you by JB Dental Labs, the elite lab trusted by full arch surgeons, prosthodontists, and digital forward practices internationally. JB specializes in precision full arch restorations, zirconia, PMMA, photogrammetry workflows, and fast turnaround times that don't sacrifice quality. JB delivers a truly digital workflow powered by their proprietary online portal for easy case uploads, real-time tracking, and fast streamlined communication. If you're looking for a lab that understands immediate load, passive fit, and the demands of modern all-on-X dentistry, then JB Dental Lab is redefining what a full arch partner can be. Learn more at jbdentallab.com.
God, first topic of the day. Yeah, how everybody just gave me this. Like I just woke up and like here, you ever feel that way?
No, I don't. That's the funny part. I think that people that assume that you've been given something are just jealous because they can't get it and they have to find some bullshit reason to make you feel like you didn't deserve what you have.
Oh,
So,
yeah. Yeah. And it's ignorance, I don't blame you. It's hard to like hold judgment on ignorant people, you just kind of like, I just don't have time for it, you know, like you're not going to like educate them, right?
no, I've fully given up on arguing with people. I mean, social media is the perfect place for that, right? I mean, some people just like to pick fights, and you'll post a case, and they have one snapshot in time. They weren't there for the consult. They didn't do the full exam, and they've assumed everything about the case. And now you're like, they're accusing you of malpractice and whatever. And honestly, like, I've I'm so busy, I just block them. It's great. I just
Yeah.
block them. I don't care. So if you're out there and, you all of a sudden don't see my stuff anymore, it's probably because I blocked you. So like I have a very low threshold for that. I
That's
don't have
funny because
time
I
for
was
it.
looking for your pages before doing this podcast. I can't find
I blocked you years ago. I'm just kidding.
them. Yeah. Right.
No, it's like
Wait,
people just like to fight. I don't know how they have time for this. Like I don't have time. And I already hate social media. I use it as a tool purely for business. I
yeah.
have no other interest in social media. And whenever it becomes a pain in the ass to me, I either get away from it or I block people. And my life is great.
Yeah, I mean, same, but I use it like on a bad day. I like to go there just so I feel better about myself and smarter. Because look at the idiots out there like, oh wow, I'm not as screwed
There's a
up as
lot of
that
that
guy.
now.
Oh wow.
There's a
Yeah,
lot of that now. I
yeah.
don't, yeah. And I try, honestly, like you can get a real negative view of things pretty quickly. And unfortunately, I think both of us have become pretty jaded with all this stuff lately. So,
Well, let's keep it positive. Let's get started, man. You ready?
sure.
You ready? I mean,
Let me take
that
a
that
sip of water.
that's okay. Hey,
I thought
by
we
the
were
way,
already going. I was like, this is great. I can do this all day.
Dr. Alex Nguyen. Nguyen.
Nguyen, Nguyen, I've had it all, man.
Okay, I've been calling you Alex Nguyen forever because I had a girlfriend when I was like 20 years old in the Marine Corps, and she was a Win, spelled the same way. Are you a Win?
Sorry to hear that. But, Vietnamese
Wait,
women
and
are
were you possibly
tough.
related to her?
I was not related to your ex-girlfriend. Odds are, I think there's like 40% of us are wins for Vietnamese people, but no, wins fine. I tell people win. It's easy. It's fine. You know, you have to just explain why, but it's fine.
How do you
Win's
say
good.
it?
Oh, dude. Yeah. The NG is like a yeah, like a wing. So
Yeah,
it's yeah. Win's good. Win's good.
that's all right.
Even Nguyen is better than like you know Nguyen or Nguyen. I got that a lot when I was in Illinois. When I was on so like back in the you're a resident, you have a pager. Like yes, we
Yeah.
still use pagers because it's reliable. So
Uh,
when the hospital paged you, you have an operator after you call back. And I had one operator that was like very confident that they got my name. And
uh,
so they were like, "Oh, is this Dr. Nguyen?" I was like, "Yeah, yeah, that's me."
Nguyen?
I don't even fight it. I don't get
It's got,
offended. It's fine.
it's got like 4 syllables now.
Yeah, right. And
That's
Nguyen.
great. That's great, man. All right, well
Yeah.
let's get the boring shit out of the way, so everybody knows you, man. Like, where'd you train? Where are you at right
No,
now? And then we'll get into it.
I don't think everybody knows me. I don't think I'm that popular. I'm Alex Nguyen. I'm a oral maxillofacial surgeon. I'm located full time in Arizona, where I own my practice, and part time in Austin, Texas. And I did my dental school at USC in Southern California, Los Angeles, and I did my residency, 4 year residency at the Carl Foundation Hospital in Champaign, Urbana, south of Chicago.
Oh, I'll bet you fit right in there. I'm sure. Nice in
Yeah,
Illinois,
with the
right?
cornfields and everything, man. Yeah. Nicest people on earth, though. Very nice
Oh yeah,
people.
absolutely. I love the Midwest, man. I just did arches for an 80-some-year-old young woman and from Indiana, and God, I just love talking to them. They're great out there.
They're so
Easy going.
nice. Like so when I moved out there, I'm from like Southern California, born and raised, and I'm not used to people like talking to you when you're out
Oh,
and like just talking to strangers, right? Saying a hi,
right.
good morning, all this stuff. So I
Yeah.
remember the first time I moved there, and then I was at the grocery store. People just started talking to me. And I was like, "Dude, what the do you want, man? Like,
Yeah.
I don't have any money. I don't
I don't
want
have any
whatever you're
cash.
selling." Like,
Yeah.
and then I just realized, like, those just people. Like, I remember the nurses, my first, holidays on call. They would just invite me to their house. They're like, "Yeah, we just keep
Yeah.
our doors are open. You can just come over." I'm like, "What if I wanted to kill all of you? Like, what the hell's wrong with you guys?"
No, that only happens in California.
That's I apparently.
Yeah.
Like, we keep our doors locked. I don't talk to strangers. I just look straight ahead when I drive. Like, I don't wanna make eye contact with anyone. But,
Oh,
yeah,
yeah.
nice people, man.
I mean, I grew up just outside Detroit, and if you drove through Detroit, we were instructed, educated. I think they pretty much tell you this in grade school. Like, do not look out the windows at people in other cars driving down the interstate. Just
Oh,
keep straight ahead.
no. No,
Yeah.
no, especially in LA, no. Straight
Yeah.
ahead, man. Just
Yeah.
focus on the road.
There's a man burning over there. Don't look. Oh my God.
Yep.
Not
Nope.
sure.
Nope. Especially when you're like, bumper to bumper traffic or something. That's the last thing you do. You don't want to look over and then be stuck with this guy that thinks you're mad dogging him. No.
Yeah, I got it, man. Let's talk about business, bro. I want to talk, I don't know where this is going to go, but you've got a good perspective. So one thing I really like about you, for everybody, I'll introduce you. You're board certified oral maxillofacial surgeon with practices in Arizona and Austin, Texas. Wife's practice in Austin, Texas. So you work there as well. You're going to I think you've got a great perspective on all on X, full arch, fixed immediate load, whatever you want to call it. I think you got a great perspective on it. Your work on Instagram is beautiful. I'll put some up here in a minute. I mean, you're known for, I know you for symmetry. You're a freehand surgeon. You put in great symmetry and pterygoids and zygos. And I mean, I'm pretty sure that your Asian math and your trigonometry is just always calculating in your head because everything looks exactly the same. Evans put up I think this is
The Neanderthal.
from that that's actually, I think he's actually from Asia. I don't think he's Southeast Asia. I think he's more Mongolian. Wrong picture, Evan. Uh,
No, I'm the Neanderthal. Remember, you're the finessed guy with the X-nav and the
the
navigation,
digital.
low stress, and then I'm the Neanderthal with a mallet and a chisel and doing everything with my eyes, ears, brain, and hands. So,
I don't know who that last guy was, but that looks like a patient I just did all on four on, to be honest with you last. um, Evan's having fun here. Um,
nice.
yeah, there's our roots. I think that's the Asian one from 50,000 years ago. But anyway, I was saying you're a renowned oral surgeon. You've been teaching for a long time. You teach from South America to Europe. So you've got a lot of perspective on education on different continents, and you practice and you have a stake in a practice in two different states. So I think we have quite a bit to talk about. You're a very accomplished surgeon, so thanks for being here with me.
It's very kind of you. I'm honored to be here. So thank you for having me.
Same. I'm honored to be in your company. I want to kind of kick off. So you're with Arizona and Texas. All right. You got two, you're an oral surgeon with married to a prosthodontist. Very interesting
She's a
perspective
general
there.
dentist, but she's been accused of being a prosthodontist before. Yes.
Oh, well, excuse me. I'm accusing her of being a prosthodontist because I've seen her work on Instagram. It's very, very nice. I like it. It's very good.
She's very good. My wife is
Yeah.
she was like that in school. She was my classmate. So that whole situation of Austin and Arizona is a really long story that we'd have to have over drinks one day. But yeah, she was my classmate. She was always really naturally good at the artistic part, and she's smart. She's gorgeous. She's my favorite person, obviously. And
Yeah.
but she's very good. And the key is, guys, she was really good at dentures,
Yes.
really good at removable and
Yes.
occlusion and like stuff like that. And honestly, like the jump from doing that to full arch, if you're really good at removable, is not that bad of a learning curve. So
Yeah.
there's some obviously there's some nuances to learn, but like in the big picture wise, that's where analog I think helps a lot
Oh
is
yeah,
learning
yeah, yeah. You're
dentures.
talking about, I think you're stealing it out of my playbook. I mean, that's what I tell everybody coming to module one is learn dentures, learn over dentures. You need to learn that occlusion. That's brilliant for
That
sure.
was my favorite in dental school was removable.
Really?
I didn't really love like the rest of dentistry. I loved removable. And
Yeah.
so and it actually helps a lot in orthodontic surgery as a oral maxillofacial surgeon. And when you do it the old school way, the palate is still the most stable position to be able to index off of anything. It's just like when you have a clear guide and with the palate in it, right? So with the troughed out palate, troughed out occlusion with the palate. So
Mhm.
that guides everything I do. And I still do analog conversions in my office because it's faster.
Now it's
But
time for the knuckle dragger picture. Now it's time for the knuckle dragger picture.
say
That'd be a
whatever
good
you
time.
want, but when my double arches are done and I can still do other stuff in the afternoon and like I don't have a risk of seeing the patient back because my patients are sick. So I always have a joke that the only patients that we get referred these days are patients that are allergic to oxygen and water. So I don't want them coming back. I just want them to rest for a week. And so
Yeah.
I do everything 100% immediate load in the
Yeah.
USA
Yeah.
for me. Everywhere I work, 100% same day immediate load.
Yeah.
So,
I honestly, I was joking about the knuckle dragger comment partially.
oh, I
But
This segment is brought to you by JB Dental Lab, your go-to partner for full arch prosthetics, zirconia, PMMA, and digital workflow. With a proprietary portal, in-house designers, and an advanced education center, you will experience reliability, precision, and consistency. Visit jbdentallab.com.
There's a place for analog workflow, and that's what we teach in Module 1. You got to learn the basics. You got to learn analog. And frankly, there's a lot of very successful, you're an example, very successful all-on-4 practitioners who are doing analog workflow. And if you're doing, and you're doing it well. So I have no problem with that at all. It's,
I think it's whatever the means to the end is, and you can cut whatever you want in terms of like costs of this and whatever, but all that matters to me is accuracy. So when you integrate, a pterygoid and a 6 implant on the lower arch, it gets a lot harder for things to be passive. And I've told people that any idiot can make 4 implants passive and work. Whatever workflow you have, 4 implants is easy. Once you start doing like a lot of the pretty much every case that I do these days, and now with the difficulty and everything like that, and maybe they're sicker patients, poorer quality of bone, like all that passivity and occlusion and stuff, like really come into play if you're going to make it last long. And that's the key is passivity. And honestly, again, maybe I just need to learn your workflow, but we've tried a lot of different things. And honestly, like analog done really well has still been the most accurate stuff that and that's in our hands. Like,
yeah.
we've tried photogrammetry, and we still do grammetry in my Arizona office. We do a lot of that, and that's been great. And some of the photogrammetry cases have been great. It's just it seems the most repeatable and accurate, and the least amount of times where we've had to like section a jig and start from scratch. Like has been just my wife doing really really good analog records because she's been accused of being a prosthetist, right? So, but it takes skill, and I really do think that if you start out with full arch, I really do think you should do your own pickup, like 20 cases. I think Juan said that, but
Yeah.
and I really do think it makes you better if you learn how to do a pickup. Especially, I'm an oral surgeon, right? I had to learn a lot of pros, and I think that any surgical specialist, like you need to learn pros, period, but learn how to do a pickup and put multi-units in the right spot. It's a good start.
Yeah, if you're not putting your implants and your multi-units in the right spot on analog, it's hard digitally, but you can
Yeah.
kind of like play with it and fudge it and work with it. You take a denture and you put your implants in, and you try to pick them up, and the implants out here, and they're off angle, you're really going to find out quickly, how much you need to improve. I mean, because it's very unforgiving. Analog workflow can be very unforgiving. But that's all in for in
It,
general.
it is, but also, the barrier of entry to digital can be very expensive. And if you're just starting out with full arch, you're not doing like 30 arches a month right off the bat, right? Like
Right.
you got
No.
to start somewhere. And in the end, the barrier of entry is gonna actually be cheaper in the beginning to do analog. And honestly, I think you're going to learn more rather than going straight to digital if you do some analog in the beginning. It'll help you like see it, like
Oh
see
yeah.
the reduction and like the just feeling the palette and like the stop and looking at the multi units emerge out in the right spot and like I don't know. Maybe I'm just a Neanderthal knuckle dragger and I
No, no, no. There's nothing wrong with that. I mean, I had to stick with analog. I mean, we didn't have digital. I mean, it didn't really exist. It had,
yeah.
I mean, it was like, it started getting more and more digital after 2018, 19, photogrammetry, 2020. I mean, it just, I think it was about then. But yeah, it wasn't available. We had to learn how to, make fire with flintstones and rocks and stuff like that. It was, um, I'm serious. When you come to, this will be, since I just said it, when you come to see us at the Institute in May, you're going to see a poster board I did it's on the front wall. I found it. I had to do a table clinic in 2003 for my GPR, and we did with the help of a maxillofacial prosthodontist, it wasn't my dumb idea. We did teeth in a day, all on 4. And I outlined the whole thing in a paper. I don't know how this survived with me through my divorce and through all the stuff that got burned and thrown out in the front yard, but I actually had my paper from 2003 and my table clinic board, and you're gonna see it, and it is barbaric what we did in 2003. It was unbelievably barbaric. So,
I'd love
but
to see that. Yeah.
yeah, I'm actually kind of like I look at it like this, you know. I didn't have any chat GPT to help me write the paper, so
Yeah. 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 What
it's
did you
cool.
have today?
What did I have today? Oh man, let me show you. I think I might have something queued up
Here,
here.
I'll show you. You show me yours. I'll show you mine.
Okay. I'm gonna see if it's up here. Wait,
Here,
Evan, you got to come over here. I can't find it. I opened up these things earlier.
there you go. I did that
Nice.
today. I did. It was a really hard case. Infratemporal zygo instead of a pterygoid because I couldn't get it. Super
Oh,
soft
dude.
maxilla, super soft. Can only fit 5 implants in the
Oh,
mandible. Really thin mandible too.
dude, those are the cases
Endpoints.
that
Yeah.
they're hard. You struggle over them just a little bit, right? But they're so worth it.
Yeah.
I'm trying to
Oh, here, I'll show
find.
you.
Oh, here.
Here, while you're looking, I'll show you
I got
my
you. All right, check
oh,
this out.
nice.
Okay, so I'm gonna call this one the remote anchorage mandible. Um, Speaking of remote
Oh,
anchorage, Dr.
like
Nguyen, Alex,
25.
what?
Oh, like a 25 millimeter to the mandible to the inferior
Yeah,
border.
25 millimeter of the mandible.
Yeah.
Um, this woman is in her 80s, and there was no resistance until you hit the bottom of the mandible right there, and none.
Yeah.
So these are 25s, 22s.
I'm seeing more and more hollow mandibles these days. That's becoming a problem for sure.
Oh yeah, absolutely. So way down at the base.
Nice.
I'm doing these. I mean, I feel like once a month I'm having to get these done. I don't know. But yeah,
Yeah.
it's um it's fun. It's fun, you know. You put your finger right here and you start drilling and you're like and then when you go slow and then you go, okay, I'm done. Okay, nothing coming out the skin. I'm good.
That's right. That's right. Yeah. It's a
Right?
long implant to go in the I got a few. I got a handful of those out there too. I definitely feel like there's more and more hollow mandibles these days. It's
Oh,
a
dude.
problem. It's definitely a
It
problem.
is before I say what I think it is, do you have any idea what you think it is? Why?
I think we had this conversation before. I think it's a
Probably.
combination of like a lot of marijuana.
Yeah.
Marijuana is definitely correlated with decreased bone density. And then I'm assuming heavy daily marijuana use. I have anecdotally seen that myself in a lot of patients, in these young
Mhm.
people, especially. Like it's like 20-something-year-olds with like just mush and like in their maxillas and their mandibles.
Yeah.
I think a lot of people are on Ozempic, and that's malnourishes you just like bariatric surgery. I did general surgery, like that stuff malnourishes you. That gets you pretty sick. And I think that and like the antidepressant, anti-anxiety meds have decalcified a lot of people too. So,
Yes. I
what's
would
your
agree.
theory?
Yeah, I mean, lifestyle's big. Sedentary lifestyle, not
Yeah,
exercising, not being outside, no sunlight, nutritional deficiencies, like you talked about. You know, I mean, anybody who's had gastric bypass or they just eat processed foods and they're never healthy, and then the longer they live, it's just those things go hand in hand. If you look at somebody, I mean, I can kind of pick out like who the poor bone people are going to be. These are the people that go, my favorite activity is sitting on my couch and eating chips, you know, and I never go outside and never exercise, and yeah, all that stuff. And then the marijuana use, I'm seeing that as a lot as well. And I think that's statistically or that's clinically shown, right?
yeah, I usually quote a paper. I'm horrible with names, but honestly, if you just Google marijuana use and bone density, it's like there's a on PubMed or something like that pulls up a thing where it's like up to 20% less bone density or something like that. Don't quote me on that, just look it up. But
Yeah.
I've sent it in your group, I think, before too when someone asked about it. So yeah, I tell my marijuana smokers like I treat them the same as like a vapor, nicotine, cigarette smoker and everything too, just as much risk. So I just tell them if you need to use marijuana, I get there's positive things about it. Just do it because it's legal in in Arizona, and it's like just fine, just do an edible or something. So at
Yeah.
least you're not putting it directly into your bones with heat. So
Yeah. Same. Same. I stopped treating smokers for all on four entirely. I don't know where you're at,
smart.
but it's
I'm about to take a tilted out, and he gets to lean from the anterior to the pterygoid now. And I'm not. I mean, otherwise he'll have to pay for me to redo it. But he smokes half a pack a day since surgery, and it's only been like what 4 years or so.
yeah.
So I'm just taking it out and just like stop
Yeah.
smoking. But
I've had
I'll
two
treat him. I just won't warranty it. But yeah,
really. I'm just kind of getting, I don't know, I'm getting older. I've had two colossal failures and it was heavy smokers. And I wouldn't say the implants fell out. They came back with like 50% bone loss in the
yeah.
mandible or the posterior maxilla. And they were like 2 pack a day smokers. And then I got
Ooh,
the last, and they both told me they were going to quit and they didn't.
of
And then the
course.
last one, I said, I got to do a complete revision. Guess what? She has no money. She can't pay for the revision. It's her fault. I told her, I'm like, this is one of the only times I've ever told a revision you have to pay. And she's like, I have no money. Like, what are you going to do? So now I'm stuck holding the bag, with infected implants or implants with bone loss. And it's just, I was like, I don't want to be in that position ever again. So,
Well, I'll say this: I did we rotated through plastic surgery and stuff, and that is an elective surgery, right?
mhm,
And a lot of them will not operate like on a nicotine smoker, like for breast augmentation, things like that. I mean, the skin flaps can die. Orthopedic surgeons will tell you all the time, like that's horrible for
yeah,
bone healing, and again, the extremities are more prone to avascular issues compared to the head and neck. And so I wouldn't say it's unreasonable for us to refuse to treat smokers because it is in the end full arch implants, dental implants, period, are an elective surgery. Like that's
yeah,
not, you're not going to die without dental implants, right?
yeah,
So
right.
treat them accordingly. I mean,
Yeah.
I'm
I'm
pretty
enjoying,
upfront with these patients. So
I mean, I'd say just go for it. Anybody for you or anybody listening out there. I know business is business. I thought my business would take a hit when I got real strict on this last year, but I think it's actually I haven't noticed anything. If anything, I've noticed more respect. And it's easier for me. I walk into the consult room this afternoon. It might have been late morning. It was the first one after my case, and my consult coordinator, my lifestyle coordinator, she says, "Oh, they smoke, but I've already talked to them. They've already heard the whole 9 yards, and they're already ready to quit because they want you to be the one to do this." So it's like, okay, now everybody's
yeah,
on board.
I agree with you. I think when you build the boundary up front, and that's why I said I'm very upfront with them. I'm just like, look, like you want this thing to last. It's, and that's the other crazy part, by the way, is because I do a lot of revisions too, and I have one right now that he's on his fourth year out. He's still smoking. He already had a total revision on the upper and lower. Thankfully, didn't need zygos, but anyway, he's still smoking, not cleaning it. He's refusing maintenance, and he insisted because, well, they never had to take it out before. And I said, yeah, that's why all your implants are out of your face, and you have new ones from me.
Yeah,
And he's got like a loose multi-unit abutment, and he refuses to get the thing taken off. And I said, okay, well, this is going to start falling apart.
yeah,
And but now I get to document you're refusing maintenance and you're refusing to do it, and you've already had this redone. But that's the problem with these people is like they repeat the same habits that got them where they were. So like I'm pretty upfront with them these days now after dealing with some of these people. And when I teach, because I always teach, I'd say my complications lecture is pretty awesome. Like that's one of my favorite lectures to give, and you'll see it in May. But like,
yeah,
I think that I tell the students, the delegates, that you think it's sexy to be the one to redo all this stuff, but you forget that they lost their teeth in the first place for a reason, and they lost their full arch for a reason. And what makes you think the third time they're gonna
Oh,
respect that set of teeth? Sometimes they don't. A
right.
lot of the times they don't. And it's like you're pulling miracles and you're asking for the patient to change 3 times in a row. I don't know, man. So it's not as
Yeah.
sexy as it sounds, that's for sure.
When bone is limited, excuses don't cut it. Core Anchorage teaches remote anchorage, zygomatics, pterygoids, advanced fixation strategies for complex full arch cases. Expand your indications, treat more patients, increase predictability. May 15th through the 17th with live surgery and cadaver exercises. Register today.
No, these are difficult scenarios, just mentally going through when they lose their teeth the first time, just psychologically coping with that it's tremendous. It's a huge weight on their on their backs, and then it becomes, I don't know about you, but I feel it as well when I'm consulting with them and talking to them about their experiences. It's a lot of weight, and then to do it 3 times, it's it's extraordinary. I've got one that I talked about it probably before, but you know, a local periodontist and a really good general dentist did it, and then an oral surgeon in Charlotte did it with quad zygos and had some failures, and then I added 2 pterygoids, and one of the pterygoids failed, and I'm telling you,
Mhm.
I have a printed skull, I'll show you in May, it was perfectly positioned, I mean, it couldn't have gotten much better. I had to come back and I had to redo the pterygoid, because there's no more zygo, she's got 1 zygo on that side, and it's like, this is our last hope, man, before we go to the patient-specific implant or denture, you
Ah,
know?
yes.
Yeah,
Ah,
and I don't
yes.
think there's any basal bone to put a patient-specific implant in on her after the failed
Probably not.
zygos. No,
Probably
it's
not.
terrible.
It's like floating in front of in the sinus and stuff too, probably. Yeah.
Uh, you got it. Perio Pat was here. He was on a recent podcast where he saw her, and we looked at the zygos, and I'm like, if I can't stick this pterygoid in a second time, which thank God we did, but if I can't do that, I'm looking at the zygo, and he's like, where? And I was like, exactly where? You know? I don't know.
I did a triple zygo in Brazil. Um, you'll see that on the complications lecture, but this other group did a quad, but they were like too close together.
Yeah,
And she kept she was opposing second molar. So of course, like they just kept loosening the pros, right?
yeah.
So our group was just supposed to add pterygoids. So the delegates got the pterygoid on the right side. They couldn't get the left. So I no CT scan, by the way. And so I just kind of figured I knew where they were. I just saw the trajectory of them. And
Yeah.
I was like, oh, I'll have room. So I just did one through the infratemporal fossa. So she ended up with a triple zygo on the left side and a double barrel zygote pterygoid on the right. So, you can find some real estate. It just gets harder for sure.
I'm looking forward to
So,
seeing May, and I wanna see all the Pythagorean theorem on your triangles when you come in and show it to me, okay?
well, that's funny. I just showed you that case. That was not
Uh,
symmetrical. So,
okay. I think
I
your
try.
phone was skewed. I think the
I
phone was
try,
skewed just a little
dude.
bit.
No, I really do try, but like, when I don't get it, I'm just happy I got torque and I can load. So, but
Oh,
yes, the symmetry is a nice dash of style points there. So,
you make me, your symmetry is great, and I'll look at your work, and you make me wanna go in there and do better symmetry. Like, I used to, before I met you, I used to go, "Got a zygo, let me get the other zygo," and then I look at them, and they're like, one's flat, one's up, or, maybe hopefully not that bad. And I'm like, I gotta be more like Alex. So I like, okay, where's the first one? Okay, where's my entry point? Is it equal? I gotta make it look just like Alex. And oh, damn it. It's a little off. Just keep working on it. Um,
for me, it's pretty simple. Like I just try to, for the zygos especially, I just I try to do the best I can to put it in the first molar on the prosthesis, like not
mhm,
cheating, right? Like not
yeah,
facing the multi its back, like actually perpendicular to the first molar, and then just low on the zygo, so in
yeah.
the lower half of the zygo, or even lower third if you have got a really big one, and that's it. It's really that simple. I want to point a dot, and then that's where I want it to exit, and that's
Yep,
where I want it prosthetically, and that's where the
yeah.
zygo's going. That's how I
Have,
teach it too. So
have,
that's how I've taught it forever.
speaking of teach it, um, okay, we've been talking about when you come in May, when you come in May. Big announcement. Dr. Alex is going to come for the remote anchorage course in May and October this year. He is going to be our token oral surgeon at the course. No, he's a great educator, by the way. May 15th, 16th, and 17th, we're doing didactics, live patient demo, typodonts, and cadavers. Doing it again in October, and with our buddy Sam Jarrett talking about subperiosteal implants. And so, man, I'm honored to have you a part of the faculty this year, man. This is great. Thanks for coming.
I appreciate you asking me to be part of it, man. I'm looking forward to it. I haven't spent much time in the East Coast in a while, so this will be good. And yeah, I mean, I'm looking forward to May for sure. And like I said, I'm in there for October for now. Let's see if you'll want me back after May, right? So
I did. It's in pencil. It's in lightly written in pencil. Very scratched. No, man,
that's
I've
right.
seen you teach. We've taught, I've been with you at Orca in Guatemala.
Yep.
I've seen you in Las Vegas. What I like about you and why I think you'll fit right in is because you got a good, you're just very candid and honest and blunt. And I think that education needs that, like educators who aren't going to sugarcoat it. And they're also going to tell you everything they've got. Like you go to a lot of courses and you feel like they're holding back or, they're telling you some of the secrets, but not all of them. I feel like you just spill it out.
Yeah. So here's the thing. When I learned how to do this, the quality of education on remote anchorage was definitely not. First off, it wasn't even close to as many options as there are now. And then the second part is the quality of it was also like, yeah, right. I remember, I'll never forget this when I first learned, right? Basically, they're just happy if you hit the zygoma. There was no like strategic placement. There was no, and then like pterygoids, like they didn't really go through the technique. They're just like, yeah, it just takes 2 seconds. You just do this and this and this, and it's done. And
Yeah.
and
Oh,
then
Juan
and
trained
then
you.
right, and then the complications lecture
Yeah.
was like a page long. It was like, yeah, there's
Yeah.
the orbit, there's a sinus, but yeah, you'll be fine. Just do it how we teach you, and then you'll be fine. And I'm just like,
Right.
dude, like that's not. So when I got offered, fast forward a few years, like when I got offered to start teaching it, I said very publicly, I was like, oh, you will never see me have a complications lecture that's a page long like that. So I've always, it's part of our specialty, right? The big part of our specialty is managing complications. And I've said this in a previous podcast, but when you do our oral boards, they don't care if you know how to do it. They could care less. They care about the workup, the medical management, anesthesia management, the why. And then like they give you a case and you have to figure out what's going on with the case. And then when they go through how to do it, if you even know a little bit of how to do it, they'll just fast forward you. They'll be like, okay, how do you do this? And you word it off. And literally like 2 seconds there, you're like, okay. So then this happens. Now what do you do? That's what
Yeah.
they care about. They spend more time caring about how you're thinking and then how you manage things when it doesn't go the way it's supposed to go.
Yeah.
And so like that's where my focus came because of our training. And that's been a big part of my focus. So then when you backtrack to having seen a lot of and managed a lot of complications and knowing about what the complications that can happen, a lot of what I teach is also mitigating that risk so that you're less likely to have the complications.
Right.
And if you do have to manage it, at least you have the exposure and you know what you're doing. So like it's just backtracking from having seen a lot of bad things. And then you go, okay, how do you avoid that now? And then how am I going to teach it so that they can avoid it and they can at least see what's going on? So like, yeah, if you're paying me to like teach you how to do something, I really have, first off, there's no way I can teach you everything that in a career and all the complications management, medical management, anesthesia management, all the stuff that you pick up over not just a residency, but a career and a practice. I can't teach that in a weekend course. There's
Yeah.
no way. But I can
Yeah.
at least try to give you like steps and
Oh,
figure out
hold
where
on.
you
You
need to
froze
learn
up
more.
on me.
That's why you go on from like remote anchorage cadaver courses and lectures and models, and then maybe you'll go to a live course, whether it's in the US or it's in a foreign country. And then after that, there's a mentorship in the office. And that's a good order to go in so that you always have some, because I didn't get any of that. I never got that. So like my pterygoid technique is completely different than all the other guys because figured out on my own. And it's a technique that works in my hands. And
Yeah.
same thing with the zygos. Like, I was always preaching forever, like just preserve the anatomy for later. So just go low and like try to be, if you're going to if you're going to go through the trouble of doing a zygo, then at least put it in the right prosthetic spot.
Right. Right. Yeah.
Why not?
Yeah.
If you're already
No,
there, just do it right. So,
you mean the excitement isn't just the zygo? There's actually going to be teeth attached to it. Yeah.
yeah. And I think people forget that. It's kind of funny that you have to hear that from an oral surgeon, but like I see a lot of surgeon specialties that kind of forget about pros when they learn how to do implants too. It's not just the
Yeah.
surgeons that have the problem with that. And I see a lot of generalists and pros even have some issues kind of
Yeah.
figure out basic prosthetic stuff when they do their full arch surgery or whatever, or
Well,
single
everybody's worried
implants
about
even.
their osseointegration score, right? And that should be 99%, obviously, 99.5%, 98 for God forbid, 98% or lower, but then nobody talks about their prosthesis success rate and, who's there to judge it, right? I mean,
I love that you said that, because when you look at literature, people always talk about survival rates, but survival rates doesn't mean complication rate. And a lot of what I see is perfectly integrated zygos with a prosthetic that needs to be tightened down every couple months, raging sinus infection, oriental fistula, obviously cutaneous fistula, as you get to see that case in May. And then you know, just things like that. And it's like people forget that survival doesn't mean, in my opinion, success. Like I don't want zygos out there with a big old OA fistula and like a raging sinus infection or like, they have to come to my office every couple months to tighten it down. Like again, in
yeah,
May, you're going to see a bunch of cases like that have I had to fix from other offices that were zygos, and they're integrated, but
yeah,
is that success if you got to keep going to your dental office just to tighten it down and you have
yeah.
a raging sinus infection?
See that
Kind of.
oral antral fistula here?
Oh, I see. Yeah,
Yeah,
yeah, yeah. In the
yeah,
vestibule. Yeah.
yeah.
Yep.
That was this afternoon going in to close that baby up again. So, I mean, you got to be prepared. You got to be prepared to do these things. I haven't even looked at these pictures yet. My assistant just took these pictures on my phone while I was working. But yeah, I mean, there's trying to get that closed up, and that's a small one. That's a really tiny one. But yeah,
Yeah.
you got to be ready to go after those.
But
Yeah,
that's what
there's
I'm
the
trying to
there's the,
say
there's
is
the
like,
first layer. I don't know if you can see
yeah, is that
pedicle.
palatal?
Yeah,
Yeah.
yeah.
Nice.
But yeah, I'll just every day I'm gathering content and I mean, I'm trying to get time to put more and more of it in lectures, but there's always something. You got to be prepared to handle those complications, obviously. That's what they say. Yeah. I mean,
It would behoove you to at least know what the complications that are, and at least, yes, be able to, ideally you should be able to manage whatever you touch, right?
yeah,
That's our kind of thing in OMFS. But in the end, like realistically, at least have someone build a relationship with somebody that can bail you out. And the problem these days in dentistry is nobody wants their patient to leave the office. How dare you leave my office to see a specialist or something
yeah,
like that? And it's crazy that they would rather just be able to say they can treat anything. And it's like, dude, I trust me. There's no amount of training that you can get that's part time that you're going to be able to manage everything. It's like in the end, you need help. That's the whole
yeah,
point of building a network. Like humans are social people. I can't fix everything in my house. I need to eventually call someone to help me. Right. I
right,
can't fix, whatever. Like I have ENTs that I work with. I did a month of ENT. I saw a bunch of fesses. I don't have the scopes. I don't really want to do it. Like they have CT navigation fest surgeries now. I'm not going to do that in my office. Yeah,
right.
I build relationships with ENTs, and they love me because I send them patients. And at the
Yeah,
same time, they're not going to tell me like, oh, just take out the zygo. It's in there. It's causing the problem. Like it's a polished thing. It's not just do the
yeah,
fest,
yeah,
and eventually they just see the light and then Yeah, but I had to build that relationship just like whatever in your neighborhood. Like if you have you try to, these people, they're like, oh yeah, this patient's on denosumab or Prolia or whatever. Like, what do you do? What are you going to do? Like, how about this? If there's an Emrange, what are you going to do?
Yeah, right.
Because this is for all of you guys. The Amos white paper is a guideline, not a guarantee, guys.
Right. Yeah.
Like I'm about to, at some point when I'm run out of cases to show, like I'm going to show this Prolia patient that had just one tooth pulled, and now she's got Emerald all the way to the floor of her nose, and
Oh,
it's really bad just from Prolia. And it's like, dude, like just don't touch it if you can't manage it, or at least have somebody that can help you.
yeah.
It
Right.
helps.
Yeah, it's a slippery slope. People come in, they've got an infected tooth, an abscess, and they're on Prolia. That's not a good situation to let it just fester an abscess, obviously. But
No.
if you can't do it or manage it, get into you. I totally agree. I want to get into something here because I think you've got a really
Sure.
unique perspective. All right, you're practicing in Phoenix and in Texas. We kind of alluded to it earlier. So you're seeing like two different ecosystems.
Mhm.
You have an oral surgery practice, right? And then the other, you're an oral surgeon in a practice,
Yeah.
okay, in Texas. So let's start with patients, Texas, Arizona. Okay, when a patient walks through the door, what are your gut reactions? I mean, how are they different in Arizona or Texas? Or are they more similar than anything?
So it's just that, so Texas is a big state, and Arizona is up, and
Obviously.
right. So I
Yeah.
would say it depends on your demographic. Just like in Virginia, I'm sure there's your DC guys and there's your Virginia Beach, right?
Sure.
So I think that's kind of a difficult thing. So we're in Austin, and then we're at the border of like Dripping Springs in Austin, in there, and that's like an upper middle class area. Initially a lot of people were moving there. I don't know how it is now because Austin's very tech heavy. So whenever like tech takes a hit, because tech is up and down, whenever tech takes a hit, then you get less patients. That's just what it is.
Right.
So I think that the Austin market is pretty difficult. I would say, at least where they're how do I say it? Like, there's more holistic people for sure over there. Not like I'm offering zirconia implants and stuff, but like there's more of that. And I think there's just they're a little tighter. They need to be more educated, and they like better service for sure. My office in Arizona is probably more middle class, which I personally love because and then there's a lot of retirees in Arizona. Where I am in Arizona aren't like the super rich, well-to-do retirees like in Paradise Valley and stuff like that in Scottsdale. I'm on the upper west side, the northwest side of Phoenix and Surprise, Arizona. So like some retirees, they retire really well. A lot of them don't. A lot of them just are counting on their monthly social security check, which is really
Right.
sad, by the way, when they could barely
Yeah.
afford just one extraction.
Sure.
Um, so safe for your retirement. But I like the middle class ones because they just, you talk to them, you can just be a normal person, and it's great. Like they're not super distrusting, but they're not like, you just have to build a relationship with them.
Right.
So I think that like I have to be more coddling in the Austin office, which
Okay.
is actually perfect for my wife because she is very patient. She's a great listener. She's like very high service. Like, every patient has like what their preferred music is. And she doesn't run like a high volume, like she's not like 5 columns, right?
Right.
Like for me, I see about 25 to 35 patients a day in my Arizona office on a non-full arch day. And that's a pretty normal day for me. And it's not like I have less service. It's just like I can work, I can move. I'm pretty efficient in my consultations and stuff. I
Hmm.
can't really do that in Austin. Like you have to just kind of sit there and just like
Right.
really hear them out, listen to them. It takes a lot longer to build that trust with with the patient. I think in our area of Austin. I don't know if that answers your question.
No, I think it's great. I mean, there's a lot that delves into that. I mean, obviously, I was too broad in saying Texas versus Arizona because, Austin, Phoenix, your specific, what'd you call the city you're in is not in
Surprise,
Phoenix.
Arizona. Yeah.
Surprise, right? And obviously, if you go to a different part of it, you could have two practices in the same city and they could be completely different. But I mean, I think you answered the question. I mean, you're successful in both, obviously. And when you go to Austin, does your wife just hold back like 2 or 3 days a month for you to do all the cases, or is it once a week, or what do you do?
Yeah, so I have dates that are set, and
Yeah,
then if so generally the way we're doing it now, I'm trying to work less weekends. But at the same time, because of, the kid schedule and everything like that, if we do a full arch, it's typically going to be on on a Saturday. And then so I because I don't have as much staff in the Austin office, I'm more likely to do less of my own anesthesia over there and just kind of
yeah,
third party that to the anesthesiologist we've been working with for a few years. In Arizona, you know, we stack surgeries like crazy in the morning, and I'm usually doing about 90+% of my own anesthesia. But I also have like a very experienced large staff. I have 10 people in Arizona. Austin's a little bit more of a smaller operation because again, it's her office. Like
yeah.
I let her run her office. Like I am just the dumb specialist. I'm the
Smart.
monkey with a knife when I go there. So I
Uh-huh.
do whatever I can to like help her. And it's kind of nice too, because like I help her when she wants me to help her, but at the same time, like I don't have to, get too involved
Right.
with the operations stuff. Like I kind of let her be her boss there. Like that's
Yeah.
her space. So um
You're going to
that's
be married a long time for sure.
No,
Smart man.
I've known her for a long time, but we've only
Yeah.
been married a couple years. But
Yeah.
like we've been together for a while, but
No, I mean, you're
still.
you're headed to a long marriage is what I'm saying. You're
Oh,
you're a
headed. Oh, I
smart guy.
see.
Yeah, yeah,
I
yeah.
see. Yeah,
Smart
I
guy.
see.
Yeah.
Happy wife,
Uh,
happy life. That's what they say.
that's right. You're doing it right. Do you ever like want to like get to Texas completely and just be in one city? And is
Yeah,
that
that's a
ever
long
crossed
story
your
too.
mind?
I'm in the middle of trying to find an associate for Arizona. That's the
Mhm.
biggest thing that will help me.
Yeah.
I'm trying to get some more time over there for sure. Just for family time and stuff. It's the distance in the beginning. I'm not gonna lie, it's not the easiest thing to do, but now we're pretty used to it now. But in the
Yeah.
end, like the kids getting older,
Yeah.
it's a lot harder to do it as they're getting older. You have sons, so
Yeah.
they need a father when they get towards those teen years for sure. And I'm stepfather, but it's I'd like to think I'm a pretty good influence on them, so I'd like to be around more, but I need someone to cover my office, and I'm really picky. I'm not trying to just hire anybody, so
Yeah.
I've interviewed a lot of people and stuff, and I'm just waiting for the right person. So I'm interviewing
Well,
someone at the end of this month, and then early next month I got another one coming. So we're still in the process of looking.
so if you're listening to the podcast, it's a tremendous opportunity. You got to get in touch with Alex Wynn,
Yeah.
Alex Wynn.
Hey, JB Dental Lab is the lab that full arch clinicians trust when precision truly matters. JB combines advanced digital workflows, photogrammetry compatibility, expert design teams, and high strength zirconia to deliver prosthetics that fit, function, and last. Their communication is top tier. Their turnaround times are reliable. Quality is the reason that so many high volume, all on X practices partner with JB Labs. Visit jbdentallab.com for reliable quality, full arch support. Tell them that the All In, All on X pod sent you.
Um, so yeah, is you see any differences in going back to business in two different areas? Okay, wait, let me back up. Phoenix has a ton of all on four treatment centers and
Oh yeah,
education
they do.
facilities. I mean, it's
So does Texas. Oh, yeah.
Texas does too. Wait,
Yeah.
is Austin as bad as Phoenix area in competition?
No, there's, how, like, I think, the Dallas and Houston are probably worse on that part. Austin
Yeah.
though is still pretty saturated. And then but Phoenix in terms of full arch, like yeah, Phoenix and Vegas seem to be the two big
Yeah.
like I'm sorry, I hate to say it, but race to the bottom kind of
Yeah.
areas that
Sure.
are yeah, a lot of full arch only centers that are a lot cheaper with maybe more inexperienced people. But yeah, that's pretty common. I am not cheap in
Hmm.
either office. And the that also means I do harder cases. That's unfortunately the how that goes. But
Right.
there are patients that will see the value of what we're providing at our price point versus what another office is providing at maybe a third or even more than a third of the cost.
They're not going to be around long. Trust me.
Probably
I
not.
have this. I have the, and you already see them going out of business. I have people that come
Yep.
here and they had it done 2 years ago, probably in Austin. I think the last one, he was Houston or Austin, and okay, where'd you have it done? And he looks it up, and we call there to get the records, and they're out of business. Hasn't even been 2 years. They're gone. You know,
Yep.
they had a double arch done for 19,000 or something like that. And guess what? I get to take it all out and do it all over again. And they go, "Can I have a discount?" And like, no, it's harder. It's it's
Well,
harder than the first
we
time.
we also have Mexico. So a lot of our patients go to Mexico and you know, they're not all like Nestor, right?
I
So
was just gonna
they,
say they don't find Nestor, unfortunately.
yeah, yeah. So but we have a I take out a lot of work that was done uh out of country. I'll just put it that way. And
Yeah.
we I'll lose patients to them too. But in the end, we've had patients call and just say like, "Hey, I got this thing." Like after I saw them for a consult, let's say they kind of disappeared, and they'll call and say, "Oh, I went to Mexico and did this, and or I went to this office and did this, and I'm having nothing but problems. Can you see me?" And I'm just like, "Well, you're gonna have to wait a week or whatever my wait is now." And
Yeah.
it's like, why don't you just go see the person that did it? Like, I don't
Right.
know what to tell you. And it's like, I don't want to be mean, but it's like, dude, like, just because Facebook says that's a good idea doesn't really make it a good idea anymore. And I don't, it's, we have a lot of things to compete with. And what I've learned is I don't really care.
Yeah.
I don't care. The market will do what the market does. And I think marketing and hype and whatever whatever tactics there are, what matters in the end is quality of product. And for us, the quality of product is like the patient care
Yeah.
and actually what the patient's receiving, not just on the surgery side, but the prosthetic side, right? And
Yeah.
is it going to last? It'll probably last longer. And I think people forget that. And when you start commoditizing what we're doing, then you're going to run into a lot of problems. And the overhead of these is high. I don't care how cheap of an implant you place and, whatever materials that you're using to cut corners, or if you're a big DSO group, a full arch for my office, like that is not the most profitable thing that I do by far. Like I still do the full scope of oral surgery. And I can definitely tell you wisdom teeth and onesies and twosies. I do a lot of single immediates. That's the bread and butter of my practice still. And
Yeah.
even though I'm more known for whatever reason for doing this full arch stuff, this is not, I will give it up in a second. What if it becomes to the point where I have to start decreasing my prices just to do it? I
Yeah.
won't do it anymore.
I mean, I think you're smart. I'm never gonna decrease my prices because I give a quality product, and it's not the same. And it's just you're gonna win some, lose some with the patients. You can't convince everybody, but they get online and they don't know what all on four is until they start looking at it,
Yeah.
and all of a sudden they start seeing all on four, all on four, all on four, and they think the way you do it is exactly the way I do it, which
Yep.
we may be close and we're at a high level. I mean, I presume. But they also think that the 10 people they see behind us on Google do it exactly the same. And, I'm like, look, get the word all on four out of your head. We do things differently. And you're going to lose people. In fact, let me pull something up. This guy, this guy came in and he's, this was the all on four he got.
Nice
Ap-
cantilever. Real
yeah,
nice.
and they
Beautiful.
ended up converting it. They couldn't do the
Nice
bottom
AP spread.
four.
Is that going to
Yeah,
be a quad? Looks like a quad waiting to happen.
it is. It is. They couldn't do the all on four, and they couldn't get but two on the bottom, and they're not very good. And then the four up top, and they ended up. He has this story. They ended up trying to convert it to these overdentures.
No bone
But
reduction in the mandible either. Yeah.
no, I mean they're not even taking out teeth the right way. Um,
Yeah.
but it's like they
So
he was with me for a consultation a year ago, and then he comes back and he's like, he's mad. He's so mad. And, he got lied to, deceived the whole time, and then this and that. But he'll tell you that on the front end, he just thought we were doing the same thing. We were just at different prices.
yeah. So what I try to do, I mean, look, I'm not gonna like give away all of our what we do on here, but like in the end, it's it's conveying value, right? And unfortunately, like that is what it is. Like if your price point is like a decent car price, and car prices are going up a lot, but like it, if a double arch is going to be like a nice luxury car, then they have to find the value in it. And if you aren't capable of genuinely, by the way, relaying that value, and your staff isn't up to par in relaying that value, you will not sell the case. And the the funny part was I've actually in the past year I've probably increased my per arch fee at least twice, and
I
I'm
have
not
to.
doing any less full arch.
Right.
And it's because, and again, for me as a business, like I know Asian, know my numbers. Overhead goes up the more full arch you do. I don't care
Yeah.
how magical you think like your systems are. Your overhead is much higher. Your your acquisition cost is much higher if you're doing a lot of marketing for full arch.
Right.
I will not make that overhead number higher. And I'm a solo practitioner. Like I have to be very smart where my money goes if I'm gonna stay very profitable and keep up and with the DSOs and whatever.
Right.
And my staff, right? Like I have a lot of staff. So again, full arch. I think Ramsey said this once in a group. He said, "Full arch is a side dish, not the entree." And I 100% agree with that. And I think you said this in a podcast before, but diversification, if you're, especially if you're young, like if you're established and you can like, start kind of narrowing down the procedures that you want to do because you've had a relationship with the community for a long time and you're well known for that kind of thing, like,
Right.
great, then
Yeah.
do that. But in the beginning, it's insane if you're fresh out of school and you think you're just going to do full arch only. Just
Right.
wait until a significant economic decline hits and see
Hmm.
how many of those patients are signing up.
Yeah.
And like I will argue as a guy that does a whole lot of single implants, it is way more of an art to do high level single implant immediates very efficiently and make
Oh
that
yeah.
very easy to restore for because again, like my wife's a general dentist, man. Like when I do singles in her office and all she has to do is like scan it and then drop a crown in and get that's low risk,
Yep.
high low overhead, high value, and the
That-
patients are almost always happier
Right. Well,
versus your typical all-in-X patient that might be harder to please, probably a little crazy,
yeah.
and like,
Yeah.
and take up a lot more chair time. So
You got to be very
anyway,
careful on your full arch patients who you select.
for sure.
But I agree with you. I struggled to, I've been at this a long time. And you talk about diversification. When I came out of the Navy and I came in here with Truman Baxter, I took a lot of endo CE and I took Invisalign. I haven't done
Mhm.
a root canal or put in an Invisalign retainer in over 15 years, probably 18 years. But I was doing everything under the sun as I got going. And then as I
Hmm.
got older, you can do more of what you want to do. And then I moved it into all full arch, but then you realize really quickly you can have three, gangbuster months and you're just exhausted and you write these huge checks to the government, followed by 3 months where you don't have hardly anything at all. And so you ride these things in waves, and I think
Mhm.
diversification is the key. You got to have something that's more love. You got to have stocks and bonds and savings accounts, people. You got to have something on the bottom.
Yeah, but see, like you've been at it for longer, so
Yeah,
you can flow with the ups and the downs, right?
yeah,
Like my goal is to get to the point where I'm recession proof. Like right? I mean, look, I owned my practice through COVID. I mean, that was,
yeah.
within my first year of ownership of my practice.
Right.
So, and then in Arizona. And like, when you go from like that full schedule to like nothing all of a sudden,
Hmm.
and all you're doing is seeing maybe 2 to 3 emergencies a day, and you're
Yeah,
still trying to like pay your staff and stay open and stuff like
yeah.
that. Like it's not like that sucks. And luckily, I would say that had more help compared to most recessions and stuff like that.
Sure.
But, it's a good eye opener of, all of a sudden your schedule is gone and
Hmm.
your income takes a good hit, right? And
Yep.
you don't have a choice.
Yeah.
That's the thing is like I don't decide what the stock market does. I don't decide what wars happen. I just have to be ready for it.
Right.
And, I think that if your entire living is based off of the most expensive and invasive procedure in dentistry, and all of a sudden you need to like, look, it's reps, man. Like if every day you're just doing full arch, like you lose the reps and the other stuff. Like if you ask me to cut a crown right now, it's going to
Oh
take me
yeah.
longer than an upper arch,
I
like
did one
from
crown in the
cut to
last
tooth.
6 months. It was for my mother-in-law. I think it was
Yeah.
6 months ago. I was like, I don't think you want me to do this. And she's like, you can do it. I'm like, I don't want to do this. But it came
Yeah.
out great. Took me like
Dude,
5 hours, but it came out fine.
yeah. Right. But that's what I'm saying is like everything is a skill that
Yeah.
can go away if you don't use it. Like, I'm a competitive shooter and I haven't done it for over a year. If I go to a match right now, I will suck. Like it's
Hmm.
going to suck. I'm going to hate it. And I'm just because I didn't put in the time.
Yeah.
And it's the same thing. Like you can't all of a sudden say, I'm going to go back and do this now. It's like it takes time to get those muscles alive again. It takes time for your brain to go back to that mode. And
Yeah.
so like for me, like at least right now where I'm at in my career, I also get bored easily. Like today's case was very difficult. The one I just showed you,
Hmm.
butter maxilla thin. Like I had to, do a few little tricks to get some torque, including with
Right.
the zygo, like purposefully overextending it, chopping it off just to get some torque, like because the zygos weren't great quality either.
Right.
And, those little things. By the time I was like going to the mandible, I was like, I'm really sick of this case. Like,
Yep.
and that it's not because I was fatigued. It was just I'm bored. I'm bored. So
Right.
like the nice thing about doing a little bit of everything is like, all right, so like I'm gonna do this cyst today, and then I'm gonna go and drop this immediate implant over here. I'm gonna go chuck these thirds, and then I'm gonna do this
Yeah.
all in X console. And
Yeah.
then tomorrow, maybe I'll do a double arch, and then we'll go back and do some other regular stuff again. It's great.
Yeah.
Like it keeps me moving, but it also, in terms of like the business side, I'm doing. I make sure things are still also profitable because again, when you own the business is different than when you're just like working somewhere, right? So it.
No, I'm sorry, I didn't mean to interrupt. Yeah, I mean, balancing that line between doing something so often repetitively that you're a master at it and you can't fail, being an expert, you can't get it wrong. Not to say that you won't from time to time, because shit happens in nature, but you just can't get it wrong, to not being bored in your practice. I get it. It's like walking that fine line. And if you were to do everything under the sun, you won't be good at anything, obviously. I want to go back to recessions. I think people need to hear about recessions. Um, I've been 23 years. I've weathered a couple. recessions, obviously.
Oh
And
wait,
'08, and I had just bought my practice in '07, early '07. And so I was scared shitless, my friend.
I'm sure you
But
were.
you know what I said to people though? First of all, I weather recessions differently now, okay? Because if you want to be recession proof, have your house paid off and your cars paid off and have no personal debt, number
Debt.
one, and
Yeah.
hopefully have 3 to 12 months in savings accounts or easily liquefiable assets so that because that is like all of a sudden you're like when recessions hit, you're like, we're going to
Yep.
be okay at home. Okay. So my advice on young people, do not buy a $2 million house before you buy your $2 million practice. Okay. Get something and
Yeah.
pay it off. All right. But
Yep.
that's my first advice on recessions. Own your shit so you don't have to worry about somebody taking it away from you if you have a bad year.
That's what happened in COVID is associates were getting laid off. They were the first people to get laid off. And I'm sure it happened in '08 too.
Yeah.
And I'm not saying everyone should own a practice, by the way. Like I definitely don't think that. But don't think for a second that your value is that high that they're
Yeah.
not going to let you go the minute something like that happens. Because
If you're an associate out there taking out a $2 million mortgage on a house and driving a $120,000 automobile fully financed, you should get some affairs in order. Obviously, we
yeah,
see a lot of that.
yeah,
It just has to be said. We see a lot of it. People coming up in my business
money.
class.
Yeah, money out means more. Look, there are multimillionaires, billionaires that are probably that some of them are broke. Like, I think that there are plenty of dentists, by the way, that look very rich that are broke. Like,
Okay.
it's when you start teaching and stuff, you start meeting people, and like you
Oh
start
yeah.
really seeing how these who. Be careful of meeting your heroes, by the way, but like you start seeing who they really how they really are. And like they're,
Yeah.
it's all, especially on social media, right? It's all this fake, like
Yep.
this is the life I want to look like I'm living and stuff. And yeah, dude, like I definitely agree with you there is saving and then money out. Your money, if you control your money out, it won't, you can take in as much or as little as you want. If you're smart, as long as you're smart with your money out, you can always keep climbing.
Yep.
And I've never regretted, like, I don't own, we were talking about this privately, but it's like, I don't live in a big old house. I don't drive this ridiculous car. I just need a car that gets me from A to B. That's all I really care about.
Yep.
And like, dude, like, I would rather buy things that are worth something and then
Yep.
actually good investments so that I don't have to keep working the way I am right now, flying every weekend until I'm 55. So.
Which for you is obviously 35 years from now. The I I you
I
come to
wish.
when you come visit me in May, you'll come to my house, I'm sure. My wife and I have a very small, like very modest house, of course, and we fixed it up and we made it nice. But it's close to the office, it's paid off. I mean, I can be to work in 6 minutes and drive under the speed limit, and it's just a good quality of life and recession proof. You like right? You owned your stuff. But the other thing about being recession proof, other than diversification, so you got the dentures and the full arch and the crown and bridge and the whizzies. But I always told my team in the recessions, I said, I don't care what's going on outside, but it's bright and cheery and sunshine inside. People still need teeth, so we're going to ignore all the extraneous noise, all the bullshit. When people come in here, if they want to talk about the stock market, you just say, hey, so what? It crashes all the time. It comes back. You still need teeth. We're getting this
Yeah.
done. And we just take an attitude of it's not going to affect us in here. And yeah, we've done fine. I mean, did the numbers dip a little? Maybe, but we did just great. You just don't let it push the noise out. That's my advice for everybody.
I'll also say I said this in a different podcast, but I said, so like a guy like you that's been doing it for much longer than me, and like I told the guy on that podcast, like those are the guys I want to talk to and learn from. You shouldn't be talking to me. I told him I do not feel like I've done it long enough to be able to tell people how to run a business confidently. And the problem is there's a lot of overconfident people right now, not just in clinical stuff, like teaching zygos when they've barely done it or whatever, right? But also like teaching people how to run a business when they've barely done it or they don't do it.
Right.
And, and it's like, I, I, I think you have to be careful who you get your information from. And, what I've always said is people that it's just like with surgery. I respect people that know how to manage complications because that means they've truly gone full circle and can manage whatever it takes on that, not just doing the procedure, but like all the aftermath, right? So backtrack that to running a business. I would say like those are the business owners that I want to talk to, the ones that have weathered not just the the ups, because you don't learn anything when you're a genius all the time.
Yeah.
You learn when you've seen the downs and also when you make mistakes, like, right? And
Right.
I'd be stupid to tell you I haven't, I've made some dumb business decisions, usually on the marketing side.
Yeah.
And, you know, print, like for example, for me, like print marketing has been awful for me. Maybe
Yeah.
it's worked for you, but like for
Not
me,
since
it's been awful.
2009.
Yeah, I keep getting for anyway. Long story short is I've wasted a lot of money on print, and I'll never do that again, right? But that's just one example. But like I want to talk to people like you that have seen like real '08 like recessions, and people are losing their not just their jobs but their homes and
Right.
like things like that. Like that, we didn't see that really in COVID,
No.
and so we've been lucky
Yeah.
so far.
COVID was interesting year because we shut down for 70 5 days, I think it was 75 days in Virginia, no patients. And I wasn't one of these dentists who was like sneaking people in the back door because they have a quote toothache, and then doing their
Yeah.
full mouth because there was an office in town doing that. Oh, you
Oh.
chipped your tooth. Oh, we can do your full mouth. Um, but I was shut down for 70. In fact, my wife got so annoyed because I just thought it was a big hurricane party for 75 days. Um, but we shut down for 2+ months, and we grew 30% that year over the previous year. It was
Yeah,
just
the
it was
the
amazing.
upswing was crazy after the
Yeah,
shutdown. So we stayed because I have hospital privileging, and so my job was to keep people out of the hospital because a lot of toothache people they go to hospitals, and that was the last because the healthcare system is completely overwhelmed, right?
right.
So like my job and a lot most I would say a lot of general dentists like shut down. So they ended up funneling all their stuff into us, and we had all the PPE and we followed all the regulations, all that other stuff. Luckily, Arizona was one of the first states to open up. Like we followed Texas pretty shortly, and it didn't last for that long. But in the end, like that, I mean, yeah, it was scary, but we were able to stay open, keep people out of the hospital, like actually get people out of pain so they wouldn't show up to the hospital and waste a bed or like get risk spreading and all this other whatever it is.
Yeah,
But the point was like that was our situation for that. So actually, we didn't really go tank. Like we were still in the black, probably. Definitely not. We weren't at the trend that we were. But I agree with you. Right after things opened up, it was like everyone got busy. And that's the
yeah,
crazy part is from then till now, it really hasn't been a downtrend. And the people in the past, maybe where are we 2026, so in the past 5 years, if you've opened a practice right now and you think you're a genius, you haven't seen anything bad happen yet. So be a little humble because I don't think you should be telling anybody how to run a business until you've seen some bad stuff happen for a while. So like give it another 5 years maybe.
yeah.
See.
Well, I mean, always be prepared for the worst, and not to spread any doom and gloom, but world economists have been predicting a pretty significant event between we're there 2025 and 2030, going back till about I've been reading about these in international journals since like 2011. They were predicting it for to be 15, 20 years out. And we're seeing some of that. World economies are shifting, currency, strongholds are shifting, new alliances, new currencies, crypto, everything. The way that Brazil and China and Russia are coming in, and is the dollar the almighty anymore? I mean, it almost wasn't a year ago. The
Yeah.
dollar was almost the
Was.
dollar was almost going to become a second-rate currency. I mean, until recent political events have occurred, and who knows what's going to happen in another 4 years. So, I'm telling you, do not buy that $2 million house before you buy your practice. Get your affairs in order.
That was the best debt for me. I mean, I went to the most expensive dental school. It was USC. It was $100,000 a year at the time. And then I government loaned everything, undergrad, government loaned everything. And that was in UC San Diego. So I was basically $500,000 principal out. And then, of course, with residency and all of the interest accrued and everything like that, it was a lot. And then, yeah, I didn't buy a home until I bought my practice first. And it wasn't really planned. It was just because I was sick of working for people. But I bought the practice, and then after that came the properties and stuff like that. So you just have to start somewhere. And in the end, like I I like job security, and I don't plan on firing myself anytime soon, but it takes a lot of work. I mean, but that's the cost. The cost is it takes a lot of work, right? Like,
Yeah.
and I mean, it's not easy running a practice, and you've done this for longer, so it's not for everyone. But I like my odds better when I'm independent versus when I'm working for someone. That's just me personally. Not everyone should own a practice, guys. I'm gonna
Yeah.
say that straight out. Like, don't
I,
force yourself to do it if you're not ready for it.
I'm gonna second that. When I am wondering, who has my back and who's the best option for me to work for, you know, feel like I feel like I am always gonna have my own back. I feel like I can always bet on myself, and I will always make the best decision for myself and my family. So I'm gonna
Yep.
put all my chips on Adam Hogan for Adam Hogan's life.
Yeah.
So that's the same, right? I mean, you
Yeah.
got to be really careful. I mean, of course, we do need good friends and colleagues and people to get our backs and help each other out. But when the chips fall, you know that Alex is going to take care of Alex.
How long did it take for you to go solo after
I've
s-
been.
after s- you were after school or whenever you got out of the military or whatever?
So I went in the Navy. That's a big, long story. I was already in the Marine Corps enlisted. I went in the Navy as a dentist, which was a great decision for me. And then when I came out, I was actually looking at oral surgery programs. And I thought that's what I wanted to do. But back in those days, they said if you're an oral surgeon, all you can do is oral surgery work. You can never you can't even take an impression on a crown, right? The idea of doing all on four and converting the denture would have been illegal, because you have to stick into surgery. And I kind of wanted to do everything. So I found a
Yeah.
mentor. I came in with him, implant genius since 1972, implant pioneer, I should say, and a genius. Uh, Prosthodontist extraordinaire. I mean, he taught me how to make dentures and overdentures. So it was a no-brainer. I was like, I'm going to go in with this guy who's been in business for, you know, 35 years.
Yeah.
And I'm going to learn. He has a concierge practice, and I'll just learn implants and surgery. Like atypically, like unconventionally. I'll go to courses. I'll go shadow. I'll go mentor. And plus, I had a great mentor here. And he retired in 11. We were there 11, 12 for about 5 years, and then I've been by myself since. So, which is about to
Oh.
change. Yeah, which is about to change.
Oh.
Um, I've tried to open up a second practice. I didn't like the way it went, having other dentists work for me. I spent 95% of my time handling 5% of my income. So
Yep.
that was not fun. But right now, long story short, because I want to talk about you, but I've got a prosthodontist coming in this month,
Nice.
and I think we're gonna have a part-time periodontist coming in a couple of days a week soon. And so I'm freeing myself up to do a few other things, but
Nice.
I
I'm
still love where
actually
I'm at.
look That's the funny part. I'm actually looking for I'm interviewing both OMFS and Perio.
Yeah,
So I'm gonna see. I think that's a good combination. Is despite how much we make fun of periodontists, guys, there is some good synergy there. I mean, I've obviously taught with the periodontist for the past 5 years, so
yeah.
it can be a good symbiotic relationship. So, but there's that, and then I'm still looking, for oral
Yeah.
surgeons too. So that's good. Congrats. That's great. It's good
Working
growth.
on it. Thank you. Thank you. I mean, when you've been placing implants for, if you like, you've been placing implants long enough. I mean, 5 years. If you place a lot of implants for 5 years, there's going to be a lot of kg that we need to sling in places. I mean, there's a lot of grafts we need to do, and I don't have the
Yeah.
time to do them all. So
For sure. I mean, I've definitely been doing implants more than 5 years, but I've been teaching it for teaching remote anchorage for 5 years. But yeah,
yeah,
I agree. I mean, the soft tissue aspect, I actually, so I'm a part-time adjunct faculty for my old OMFS program. I just went there last weekend to do a case with them. I do model surgery, lectures, and I tell them like, look, like I know we talk a lot of shit on perio, but like you can learn some soft tissue stuff from them, and it does matter. And then I said, also say you need to learn pros, and I don't have time to teach you pros, so you need to go out there and learn pros, or come to my office and learn some pros, but
yeah,
learn pros.
right.
So
Yeah.
pros and soft tissue, right?
This episode of the All In All NX Pod is powered by JB Dental Lab, your full arch lab partner for predictable, beautiful, and digitally precise results. From provisional same-day conversions to final zirconia, JB delivers consistency, communication, and craftsmanship that elevate your practice. Their proprietary case portal keeps your team connected with quick communication and real-time updates, while their in-house designers and comprehensive full arch services ensure precision from conversion to final zirconia. If you're looking to grow your skills, JB's Educational Center hosts hands-on courses with live surgeries. Ready to streamline your All NX workflow with a lab that truly understands the surgical and prosthetic connection? Visit jbdentallab.com and tell them the All In All NX Pod sent you. Thanks for listening.
That's what's going to bring it all home. Well,
Yeah.
my friend, speaking of home, what time is it there? Are you in Arizona or are you in Texas?
I'm in Arizona. It's
Okay,
almost 7 here.
7. It's almost 9 here. I'm trying to get some pods under my belt because in March, and so I'm here at the office late, but in March I got to take care of my wife. She needs to have something done, and I'm actually going to be out of the office for a month.
Oh
And
wow.
yeah, so my associate's joining me just in time because I would take this time off to take care of my wife regardless. But I'm going to be out of the office for
Absolutely.
a month. Yeah. So it's a lot,
Well,
but I'm actually looking forward to it because she needs me and I want to be there for her.
yeah. No, I hope everything's okay. And whatever
Yeah,
it is,
I'll talk about it because I think people need to know about it. So, she's a woman and she's a petite woman and it's a condition that it's called the SMA or Nutcracker syndrome, lower pelvic compartment syndrome, if you ever heard about it, where, the renal vein gets kind of cracked and obstructed. And it causes a lot of pain and gastrointestinal issues and things like that. And they don't really teach doctors, physicians how to take care of this in med school. And they'll admit that. Um, but I think up to 15 million American women suffer from it. And
oh wow.
it's a pretty intense plumbing issue, if you will. And we're at the last stage of it. We're going to Salt Lake City, and they're going to remove a kidney and reposition it, and to get all
Oh,
the convoluted structures stop them from impinging on each other. And she's had all the stents and everything, and it's just we have to do this last step. So, yeah, more people need to be aware of it because they told my wife for gosh, 8 years that she either had constipation, diarrhea, or diverticulitis. Deal with it.
yeah. Classic abdominal things.
Yeah,
Yeah. Man, I hope all that goes smoothly and all the best to Allie and, you
yeah,
know, just yeah, that's something I can understand you need to take a month off for that. Yeah.
yeah, yeah. We're gonna do what has to be done on the family front first because that's what this is
For
all
sure.
about. Taking care of family.
Absolutely.
So I am actually I would be remiss to say I am gonna come back to work for 3 days to teach our digital workflow course because we already had so many attendees signed up for it. I didn't want to move that, so her mom and aunt and sister are going out there for a few days, so I come back here for just a couple and do some teaching.
Got it.
Yeah,
Yeah.
yeah. So
Yeah, well,
anyway,
all the best. I hope that goes smoothly, and hope speedy recovery to Allie. So by the
yeah,
time
thanks.
she should be, so in May, then she should be pretty, what, 2 months post-op. So
Yeah.
man,
God willing, I mean, it hit me today that we're like 3 weeks away from doing this, because, my wife's everything to me. And, she certainly saved my life. I'll talk about that one day. But
mine saved
you know,
mine too.
yeah. So, I mean, I'm
I'm
like, it hit
with
me
you.
today that we're 3 weeks away, and I'm like, man, I just pray to God everything comes out okay. But
Uh,
May should
yeah,
be, maybe we should be okay by May 15th, I hope.
I hope so. I really do. I mean, that's 6 to 8 weeks. That's the magical healing time for most things. So, like I said, all the best. And yeah, man, no, I'm with you, man. My wife saved my life too. So if something like that happened, dude, I no different of a reaction. So,
Yeah.
like I said, I hope it all goes well and all goes smooth. She seems
Thanks,
like a
man.
fighter. I don't know her that well, but she seems like a fighter. So I'm sure she'll be fine.
Oh, yeah, I mean, just gotta get to the physical, but she is, man. The women in our lives, it should be another story. I mean, um, this greatness that we have here, it didn't come just solely on my back. I mean, she's been there to support the whole time, and in fact, she's now our CEO. And people are like, "Oh, your wife is in the practice." No, my wife runs 3
Runs it.
businesses we own. Like, she's not she doesn't collect the mail. She runs 3 businesses we own in the real estate as well. She's a smart cookie, and she's got a lot of fortitude. So, I mean,
Yeah.
we we're only a reflection of those around us, and our wives are our best reflection.
Oh, 100%, man. Like my wife is my biggest fan, and she's definitely saved me many times from me. And I owe a lot to her. And like I said, she's a good advisor. She's very smart. She's good at watching people and just like seeing little nuances of stuff that I'm gonna miss, and she's a good like third party to what's happening in my life and stuff. And so, actually, like I had talked to her. I think I told you this. I had talked to her after you reached out to me, and we had a good talk about moving forward with you and everything. And like I said, she's all for it, man. So she we have good wives. I don't think we'd be alive today if we didn't have good wives. So.
I would not. I'll tell you
Yeah.
definitively, I would not, for sure. But, yeah, that's a story, for another day. I'm gonna need about a 2-hour monologue on that one.
That's a good podcast.
Maybe. We'll see when the time is right. We'll chat about it. I'll probably fill you in more when I see you in person in May, okay, my friend? When I see you in May, I'll probably tell you more. We sit out back, by the fire or by the pool or whatever. We'll chat more in person.
Oh,
Uh,
100%. Yeah, that sounds fun. I'm looking forward to it. I really am. So,
yeah, I am too. Okay. Find an Alex Swin on Instagram, social media, Surprise Oral Surgery, and you have 2 sites, right? On Instagram?
yeah, the surprise oral surgeon one's just for the office. It's like for patients and stuff. That one's surprise oral and implant surgery. The personal one and the one with all the teaching and my course schedule and all that stuff. That's Alex Nguyen OMFS, ALEXNGUYEN OMFS.
All right.
And yeah, it's literally me in these scrubs. So with
Hi- His name will be spelled in the description under this podcast. You guys can grab it. It's not.
need all the help you can get.
But you're teaching in Brazil, you're teaching in the USA. I've seen you teach overseas, I think in Europe as well. And you're going to be in illustrious Virginia Beach, Virginia on May 15th. I'm proud to have you, my friend, and I'm proud to call you my friend. Thank you.
Yeah, man. No, like I said, looking forward to it. I'm honored to be here, honored to be on the podcast, and happy to be a part of the Atlantic Implant Institute. And looking forward to it, man. I think it'll be the start of something really good. So
And if it goes well, and I'll have my secret shoppers watching. If it goes well, we'll do it in October.
yes.
All right, buddy. All right, you have a great night, man. Thanks for spending some time with me.
Yeah, man. You too. It was good talking. Have a good night.
Hey, if today's conversation resonated with you and you're looking to sharpen not just your technique, but your judgment, your discipline, and your long-term vision, then this is exactly why we built the Atlantic Implant Institute. This is not just some weekend course or module. This is not just some highlight reel. This is not just some collection of disconnected modules. This is the core continuum for education and full arch workflow. It begins with Module 1, Core Bootcamp Fundamentals, where we establish surgical foundations, diagnostic discipline, and repeatable decision-making under real-world pressure. And then it continues with Module 2, Advanced Prosthetics and Full Digital Workflow, where occlusion, vertical dimension, aesthetics, condyles, and execution all converge. And then we have Module 3, which tackles remote anchorage, pterygoids, zygomatics, complex anatomy, taught through biomechanics, planning for predictable outcomes. We also teach FP1 philosophy, not just FP3 solutions. And after the continuum, we have modules in FP1 fixed immediate load and also business, how to 5. This is business, leadership, and operational strategy so that you can build surgically what actually works in practical business. If you're ready to go into full arch dentistry with intention, structure, accountability, and purpose, you can learn more at theatlanticImplantInstitute.com.